Hello, thank you for joining us. My name's Mark Littlewood. I'm the Director General at the Institute of Economic Affairs. The following video is from one of a series of webinars conceived and hosted by the IEA to understand and debate many of the issues around COVID-19. In this film, recorded just at the end of the UK's third week of lockdown, we hear from the IEA's Head of Lifestyle Economics, Christopher Snowdon, who considers the future of public health agencies after coronavirus. I hope you enjoy the video.
Thanks for having me. Thank you everybody for joining me here in my office today. I hope next time we meet will be under happier circumstances. So yeah, I want to say a few words, give you a few of my thoughts on what the current crisis could mean for some kind of reform of public health. As Mark mentions, I've for many years now been calling for reform and have urged people to require their public health agencies to deal with genuine public health issues for a range of reasons I won't go into now, but I explained in Killjoys at some length. I think that clearly we're in an early stage still, unfortunately, with coronavirus and with the lockdown, with our response to it. But I think that people have been learning certain lessons, or at least maybe relearning certain lessons. One thing I think we're learning or relearning is the meaning of words. The word epidemic, for example, now has a more concrete meaning than it has had in the recent past in public health. It seems a lifetime ago that America was panicking about the high school vaping epidemic or the Juul epidemic. We've heard a lot about the obesity epidemic. And these things are not epidemics. And they can't be because they're not contagious problems. They're not contagious diseases. They're not diseases at all, actually, in the case of obesity and vaping. They are described as epidemics to try and generate the kind of panic that we're now feeling for more rational reasons about COVID-19. Another word that I think we're learning the true meaning of is public health itself. And I have been, for years, been trying to distinguish between what I call public health in speech marks and actual public health problems. And the distinction is enormous and absolutely critical. That public health in its traditional and accurate sense of the term has to involve a problem that affects the collective and is a problem that can only be solved by collective action. And there aren't that many of those, but they are very serious. So we're really talking about environmental pollution is not something you can just opt out of if you live in a very smoky city. And contagious diseases. You can do your best, you can wear a face mask, but you cannot guarantee that you're going to escape catching an infectious disease without some form of collective action that could indeed be coercive. And there is nothing at all paradoxical, despite what some people have said in recent weeks, about libertarians supporting the kind of draconian measures that are now being enforced upon us. We can have certainly a debate about how far we should go and whether the science backs some of them up. But in principle, there is nothing wrong with the government using coercion to protect people essentially from other people. We're being protected from people who would unwittingly give us a potentially fatal virus. And that kind of stuff is wholly different to the so-called public health problems of sugary drinks, e-cigarettes, alcohol, and so on. So in short, I think we're learning to have a bit of perspective about health issues and what public health really means. The other thing we're learning is that public health agencies don't always get things right, and sometimes they are downright misleading. To give you one example, until a few days ago, the US public health agencies, including the Surgeon General, were telling us that face masks are totally useless when worn by the public. Doesn't matter whether the person has the disease or doesn't, you're not going to have any benefit from the general public wearing face masks. And then a few days ago, this advice completely changed. The Centers for Disease Control started advising Americans to wear face masks. Donald Trump has still said that he will not be doing so, but that is the general advice. And although the science is somewhat mixed on it, it does seem clear that there is at least a partial benefit from having large numbers of people wearing face masks in public. And it's probably no coincidence that the countries in Asia that have managed to get a handle on coronavirus have a history and a recent habit of wearing face masks. So it was, I think, a noble lie to claim otherwise. Noble because the real issue is you want your frontline medical staff to be wearing face masks, and if everyone's panic buying them, there's a danger that they might run out. That is perfectly reasonable concern. It could even justify a ban on the general public buying face masks, potentially, if there is that much of a shortage. What is not true is that there is no benefit from the general public wearing face masks. Public Health England last week put out a press release in the midst of all this, trying to encourage people to give up smoking on the basis that smokers are 14 times more likely to die from coronavirus if they catch the disease. This flies in the face of the reasonable amount of evidence that we've already gathered so far on this, which doesn't seem to suggest that smokers are overrepresented in hospitals with COVID-19. In fact, they're surprisingly underrepresented. And there's no good evidence that smokers are any more likely to die from COVID-19. They may well be. There are certainly plausible reasons to think there might be some increase in risk. But the claim that smokers are 14 times more likely is implausible to begin with. We would see this on the ground for a start-up. It's also based on a study that included just 5 smokers. 3 of them progressed and 2 of them recovered. This is just simply not enough to base any kind of evidence on, particularly when you have a lot of contrary evidence. But Public Health England focused solely on that one study and put it in the headline of their press release. And then, of course, you've got the World Health Organization itself, which has not covered itself in glory, to say the least. Now, admittedly, they've been misled by China throughout this, but the WHO has seemed strangely willing to be misled and to pass on this misinformation to the public. So, in short, the credibility of some public health agencies has been undermined by their own activities during the course of the pandemic. And as someone who has spent years trying to get people interested in organizations like PHE and the World Health Organization, this is a good unintended consequence of our current problems. The more people look at how these organizations operate, the more mistrustful of them they are, and the more that they also, like me, seek some kind of reform. The WHO definitely has been the most criticised agency in all this, although the Surgeon General and Public Health England not been very far behind. But the levels of incompetence from the World Health Organization has almost certainly cost lives. There seems very little doubt if they had dealt with COVID in the same way that they initially dealt with swine flu, that albeit swine flu is a less lethal virus, that it wouldn't have spread anywhere near as fast and far fewer people would have died. The World Health Organization, I mean, particularly Dr. Tedros, who is the Director General, at times they've acted in quite bizarre ways, banging on about, Lady Gaga's birthday and insisting people use politically correct terms. They're not going to cause stigma and so on, including terms like suspected cases. Apparently, we're not supposed to talk about suspected cases or talk about people spreading the disease. These are their kind of obsessions. They're just today complaining about one of the tobacco companies lending ventilators to the Greek government, saying this is a breach of the Framework Convention on Tobacco Control, which incidentally it isn't. So they're wrong on the facts, and I think clearly wrong on their priorities. Public Health England, they've been attacked for different reasons. Excellent report came out from the Adam Smith Institute. Was it this week or last week? I lose track of time. Quite recently, anyway, by Matthew Lesh, looking at the rather pig-headed attitude Public Health England have had towards getting the private sector involved in diagnostic testing. And the big controversy, I think, over the last week has been the lack of testing. Public Health England are partially responsible for doing that, and they're part of the deal, on their part of the deal, they've let themselves down. There's a really big element of you had one job to all this stuff for organisations like Public Health England and the World Health Organization. And perhaps one of the big issues is, as far as these people are concerned, they don't just have one job. They have a whole load of jobs. And dealing with infectious diseases is, in the case of Public Health England, actually really quite low down the list. You know, they say in their annual reports every year that their number one priority is protecting the public from infectious diseases. Only about 2% of their budget actually goes towards that. If you include standard immunizations for which PHE are responsible, it goes up to 13%. So if you're looking at MMR and hepatitis C, TB vaccinations, yeah, they're in charge of buying all those and stockpiling those vaccines. But in terms of dealing with potentially fatal new diseases from around the world, only 2% of their budget goes on it. A lot less, for example, than goes on obesity or childhood obesity. Other people who have, like PHE, been more closely examined, and in many cases, this is the first time anyone in the general public's heard of them, are Richard Horton, the editor of The Lancet. He's been the editor of The Lancet for about 25 years. He's been on Question Time. He and also John Ashton, who used to be the president of the UK Faculty for Public Health, have more or less exposed themselves as being highly politicized, far left hysterics in many cases. And these are very mainstream people at the top of the public health lobby. Then you've got the pressure groups who have found, I think, the last few weeks more difficult perhaps than the rest of us have, because people simply aren't interested in hearing about why we need higher taxes on alcohol or graphic warnings on cigarettes or whatever it may be. And they have spent a lot of time attacking some of the companies who actually have been helping out in a really tangible way. I mentioned the tobacco company that was giving ventilators to the Greek government, and apparently the WHO would rather people die than accept these ventilators. But some of the temperance groups have been attacking Diageo, who have been turning their hand to producing hand sanitizer for free and using their massive distribution networks to get these important products out there. I believe AB InBev have been doing the same thing. British American Tobacco and I think also PMI, Philip Morris, have been started doing work looking for a virus using the tobacco leaf, which I understand is actually quite a promising dimension. But again, they've been attacked. They've been attacked for trying to get credibility in the public eyes or get themselves back around the table with politicians and all this kind of nonsense. So there have, purely because people are much more interested in these kind of organizations, and particularly the WHO. As I said before, I've spent years trying to get people interested in this. I've written about the WHO, their lack of accountability, the lack of transparency, the fact that they put out these political documents under the cloak of anonymity, their incompetence in dealing with previous epidemics, and their obsession with lifestyle regulation and policy making. And frankly, their anti-capitalist intentions, the kind of obsession with disrupting the market, their distrust of the private sector and of the free market. I've been trying to do this for years, and now all it's taken was a massive pandemic and people suddenly start paying attention. And that is not a bad thing in terms of getting something done about the waste and incompetence and corruption once the dust settles on this particular issue. Many of you will have seen what Donald Trump's been tweeting about this, and will have heard him say that he wants to have a moratorium on WHO funding with a view perhaps to freezing it or defunding WHO, which would be a massive deal. America is its biggest funder. And now I appreciate Donald Trump has all sorts of reasons of his own for wanting to blame the WHO and indeed blame China for the problems that America is currently experiencing with coronavirus, which are pretty much off the scale in some parts of America, particularly New York. But be that as it may, he still has a point. And it's the only thing that's going to work. The only thing that is going to get reform in the WHO is if you threaten to take their money away. The UK actually, on a per capita basis, is a bigger funder of the WHO even than America. We are the single biggest funder if you look at it on a per capita basis. And I think we should be doing something similar. I mean, to give you an example, a pertinent example, the WHO has its big tobacco wing, the Framework Convention on Tobacco Control. They have their big conference once every couple of years. The public and journalists are kicked out as a tradition. The first day, zero accountability, almost beyond parody beyond the parody of what the WHO is. The UK is far and away the biggest funder of that. Provides 70% of all the money that come from individual member states. And yet, what does it spend most of its time doing? It spends most of its time attacking vaping and indeed other reduced harm nicotine products, encouraging many countries to ban them, if not excessively regulate them, all totally at odds with the UK government's position on this. Now, I'm not suggesting that any particular member state should be able to buy overwhelming influence, but it does seem peculiar that our government in Britain is supporting that specific part of the WHO's program when it is in direct contravention of what Public Health England and the UK government's approach has been, which has been, of course, to be fairly supportive of vaping and next generation tobacco products. I think it's only if member states and indeed individual donors threaten to pull their money away, there will be a serious conversation about reforming the WHO. What kind of reform do I mean? And this goes beyond WHO to public health systems around the world generally. Well, I haven't changed my view since before the coronavirus pandemic began. I've always said they need to be stripped down to do the work that needs to be done on contagious diseases. And there are still, as well, I mean, even leaving aside coronavirus, there are still contagious disease outbreaks in Britain. We have seen an upsurge in measles. We do have TB outbreaks. This is still an important area, even in rich countries. But imagine how they feel in developing countries. We're here with a major outbreak of infectious disease, and people are starting to think, well, actually, why is Public Health England spending so much time taking the sugar out of cakes? Why are we spending all this money doing seemingly fairly banal research? Why are we spending £400,000 so that some researchers in Scotland can go to football matches and write a study about why people drink alcohol at the football? If we think that's bad, imagine what it's like in developing countries which have outbreaks of infectious disease all the time, and have the WHO going over there saying, you really need to have plain packaging for tobacco, you really need to have minimum pricing for alcohol. Why haven't you got a tax on sugary drinks? So this is an ongoing problem, which is only really being brought to the attention of the West because we're currently experiencing the kind of diseases that the WHO was founded to eradicate, and it simply has clearly failed to eradicate all sorts of diseases like malaria, and could be doing much more on these issues if it wasn't wasting so much money on all this Western lifestyle stuff. So these organizations need to be stripped down. Now, it could be argued, you could argue whether they can still do both. Well, maybe we should put more money into the infectious disease program at Public Health England, but they can carry on with the food reformulation. I mean, apart from anything else, I don't think an organization should be trying to do everything. I'll read you out something that was written in the British Medical Journal, I think, only a few months ago. This is from some people who are at the Association of Public Health Directors. It gives you an idea of what these public health people think is their remit. It says, since transferring to local authorities in 2013, public health has broadened its worldview, taking a leadership role in diverse agendas such as reducing violent crime, economic policy, educational attainment, and environmental sustainability. Public health professionals are increasingly involved in a far wider range of service areas, covering children's services, parks and green spaces, transport, economic policy, libraries, and housing policy. Now, I just don't see how you, as a specialist, you can have enough knowledge even to meaningfully contribute to all these vastly complicated areas of politics. It's simply politics. These are people who just want to get involved in every area of politics, even if it's, as it inevitably will be most of the time, well beyond their area of expertise. So I think that departments absolutely should be specialists in certain areas. We don't need a lot of this nanny stuff, the nanny state stuff, for all sorts of reasons that I've written and spoken about elsewhere, and I haven't got time to go into now, and hopefully you're familiar with some of the arguments. But like I say, it comes back to it. You had one job. If you've got one job and you've been doing lots of other things because they kind of interest you, you think maybe they might be kind of important, and you fail at your primary task, the public has a right, I think, to tell you to get back to your knitting, as it were. So for those reasons, I think a case can certainly be made, and I'll certainly be making it, that these organizations do need to be looked at once the dust has settled on this. I'm sure there'll be some kind of inquiry. I don't think PHE and World Health Organization for two will come out of this very well. I think actually who've come out of it well is the NHS, Department of Health, I think. The Chief Scientific Officer, the Chief Scientific Advisor, seem to me, generally speaking, to have been on the ball. They produced a plan from day one, which is clear to me, at least. They've followed it. They've been very transparent in the way they've dealt with the public and spoken to the public every day in the daily briefings. The NHS, I think, has actually performed fantastically well in setting up NHS Nightingale, for example. We haven't gone anywhere near over capacity, even though we seem to be reaching the peak of cases in Britain, touch wood. But it's interesting, is it not, that it's been the Department of Health and the NHS who have been leading in the response to a public health emergency. It has not really been Public Health England. I'm sure they've had an input and they've got lots of good scientists working in virology, but it's been led by, and all the resources have come from, the Department of Health and the NHS. Surely there is an argument, given that, as I said before, Public Health England's stated primary objective is to protect the public from infectious diseases, for Public Health England to be doing that. Or are they not good enough to be doing that? What are the reasons? But we've got a lack of specialisation here. So, of course, I'm going to say that these people should be sticking to their primary function and leaving people alone. It's a question of how resources are best used and what your return on investment is going to be. And your return on investment, realistically, would have been a lot higher had PHE been stockpiling surgical masks, for example, then to try to reduce the amount of sugar in chocolate by 20%, or going around lobbying for minimum pricing in England. So I think there is some reason to be optimistic about it, simply because sunlight is the best disinfectant. The public have seen how some of these agencies have handled and mishandled the crisis. I'll finish, however, on a pessimistic note, as I always like to, which is, of course, it could go completely the other way. That we could see huge demand for more public spending on so-called public health issues, and that increased spending continues to be diverted towards political agendas and nanny-state causes. We might also see, as a result of the lockdown and the amount of illiberal regulation that the public has had to temporarily put up with, that people actually get a taste for it. And we have seen, I think, from the police and from many members of the public, an appetite for authorities to go even further than they already have done, and go beyond the law in clamping down on people's behaviour. And finally, the pressure groups, the single issue pressure groups looking at areas such as drinking, smoking, vaping, they have not gone away. They've repurposed themselves. In South Africa, they banned tobacco and alcohol as part of the lockdown. Very quickly, senior politician, I think, or maybe it was a police chief, said, "This is great, crime's gone down, we should ban alcohol permanently." There have actually been alcohol shops looted, so there's been a kind of a change in the type of crime committed rather than necessarily just a reduction. Tobacco Control Journal this week put out an editorial which was covered in various outlets, saying that we're enacting draconian legislation to tackle COVID-19. Smoking kills more people than COVID-19 probably will. Therefore, we should ban smoking. In the US, the vaping so-called epidemic happened last year, but the people who orchestrated it have adapted to the new world and are now claiming that people who vape are more likely to develop or die from coronavirus. So it is far from certain that the lines between public health and real public health will not continue to be blurred, and that this crisis, having led to the public tolerating illiberal and authoritarian regulation, may leave the public more prone to accepting more of it. And this really, of course, was the point that Hyatt made in The Road to Serfdom, which was the book that ultimately led to the foundation of the IA, which seems a good place to end it for now. Thank you.
Thank you for watching. I hope you agree that Chris gave us a lot of food for thought in considering what public health agencies should look like when this pandemic has passed. For more information on the history of pandemics, the economic and regulatory impact of coronavirus, and much, much more, please do subscribe to our YouTube channel by hitting the bell, and that will give you notifications of all of our upcoming videos. You can also follow our podcasts at ieapodcast.podbean.com. And finally, visit our website, www.iea.org.uk, and you can sign up there for the IEA's daily news bulletin. Thanks for joining us.